Welcome to this poster presentation. My name is Mariët Faasse, and on behalf of the perioperative medicine team at University Hospital Southampton, I'd like to talk to you about the assessment of drinking, eating and mobilizing, also known as dreaming. As many of you may know, dreaming is frequently used as either a patient-centered postoperative outcome measure in individual patients or a process outcome for assessing compliance to enhance recovery pathways. To date, there is limited research available focused on dreaming for assessing the restoration of function. We therefore looked at the dreaming distribution on the first 3 days after surgery. Next, we looked at the associations of dreaming with both a prolonged length of hospital stay and significant morbidity. Finally, we used the postoperative day with the strongest association with these traditional postoperative outcome measures to find which pre- and intraoperative variables could predict dreaming. We studied 355 patients who underwent major elective colorectal surgery at University Hospital Southampton between 2016 and 2019. We had to exclude 43 patients as their dreaming data weren't complete for all the 3 days. As you can see in this figure here, the eating component was least present in all days, and the components were more often present together over the days. The vast majority of patients who started dreaming kept dreaming over the next days, and on the other side, most of the patients who were not dreaming on day 3 didn't dream on the days before. When you look at the table below, you can see that the dreaming on day 3 was most cumulatively associated with a prolonged length of hospital stay, longer than 6 days. Finally, we found that significant morbidity and dreaming on that day was predicted by BMI, duration of surgery and surgical approach, which is open versus laparoscopic surgery. In conclusion, we found that dreaming well represents a patient's restoration of physical function after surgery, as it was associated with other traditional outcome measures on all 3 different days, and it was predicted by some pre- and intraoperative variables. Furthermore, our study suggests that dreaming has the most utility in presenting the restoration of function on day 3 over the other days, as prolonged length of stay together with significant comorbidity was most associated with dreaming on that day. Thank you for taking your time to listen to my presentation.